Greetings and welcome to In-Depth. I'm Dike Rostant. We are really looking forward to learning more about fibroids and the fantastic work that Fibroid Awareness Trinidad and Tobago is doing. Now we're joined by the founder and women's health advocate, Clarice Archer-Nancis, who among her accolades, she's also a recipient of the Chief Secretary's Award in the sphere of women's health awareness and advocacy. Don't play with it anymore. She joins us now to discuss this labor of love. Good morning, and thank you so much for joining us. How are you doing?
I am doing fine. Good morning to you as well, and thank you for the awesome opportunity to share on what you've aptly titled A Labor of Love.
And I'm really happy to have this conversation with you because there are anecdotes, there are songs. I remember Black Prince, he has a song called Fry Ball, where he thought that this young lady was pregnant for him, and it was apparently a case of fibroids. So what are some of those common misconceptions, things that get just thrown out that are less than factual when it comes to this phenomenon?
All right, so I think that misconceptions are an absolutely perfect place to start. And it's funny that you've used that term, right? Fry balls, fireballs. I have heard so many terms in this space, and I think we can start there. So the name, misconception. The first step to change is awareness. And if you're not aware, how can we start having conversations about treatment and really moving forward as it relates to navigating and overcoming what I call, this is a scourge, right? Misconceptions that fibroids are cancerous. They are actually benign. The prevalence of cancers associated with fibroids are not, they're not the highest. And so that's one misconception and fear that pervades where fibroids are concerned. You know, another misconception is that fibroids, and I want to be very delicate about it because there are fertility implications, but there is a misconception that fibroids absolutely impacts your ability to have children. So if you have fibroids, you can't have children, and that is a misconception, right? And I'd like to stay there as it relates to the misconceptions in this space, and move the conversation forward about awareness surrounding fibroids, why we need to advocate for earlier diagnosis, and of course, the foundation and the work that we're doing for this month, July, which is Fibroid Awareness Month.
And possibly we can get back to some of the misconceptions, but when you talk about early diagnosis, how do you go about? Is there an age from this age in the way that some people are saying, okay, well, from this age, gentlemen, start to get checks one way or the other for prostate issues? When do you start seeking to check or test for fibroids? And are there any, I guess, telltale signs that say, maybe I should go and check?
Beautiful. So signs and symptoms. Again, and this is also linked to another misconception, not necessarily about fibroids, but about menstrual health. So we'll start at period pain. Culturally, we are taught that it's a rite of passage. Periods are painful, and it's okay. Period pain is not normal. Excruciating period pain is not normal, right? Becoming anemic because of heavy periods is not normal. It's usually a sign that something is amiss. And so very early on, when I think of my own journey, being diagnosed at a very young age in the grand scheme of things, fibroids started impacting me during my teenage years, but I was unaware. So by the age of 19, when I got the diagnosis, the fibroids were far gone. And when I say far gone, pretty large. I actually remember the doctor saying to me, you're either 6 months pregnant or you have fibroids. So that is how far distended my uterus was. And Dike, you won't believe when I got this diagnosis, right? When I just moved to Jamaica. And I'm sure if you remember our UE days, I was much slimmer. I didn't have a protruding stomach, but I was carrying around multiple fibroids, a very large one at that as well. And so diagnosis, you won't necessarily get up in the morning and just say, let me go and get an ultrasound, because that's how you'd find out if you have fibroids. Imaging has to be done, right? There's no other test, no blood test or anything like that. You have to do imaging to confirm the presence of fibroids, which are growths on and around the uterus, the female reproductive organ. And so you have to look for the signs and symptoms. We talk about the excruciating pain, very painful period. We talk about heavy bleeding. And again, this can be very subjective. So I'm going to get a little graphic. But if you have to change your pads very regularly, that's not normal. And when you say regularly, some women, even girls, you start doing things to cope. So you find yourself wearing menstrual products for maternity because of how heavy the bleeding is. You find yourself having to use adult briefs to reinforce so that you don't have the mishaps, right? The leakages, because your pad overflows regularly. Heavy bleeding is not normal. The pain is not normal. Some persons may experience bulking because the fibroids grow. And so you can actually feel them in this belly area, the lower belly, the lower region, close to your pelvic region. Some persons can actually feel, right? And then, of course, you spoke about Prince and him expressing in song that he thought someone was pregnant, but they had fibroids, which were really fibroids. Some women can look pregnant because of the size of fibroids. So they can be as small as a chenet or a plum, even smaller. They can get up to the size of a watermelon. Yeah, so the disparity in size is there. The symptoms also vary because you could have fibroids and they are asymptomatic, right? Some women only find out about fibroids when they conceive, and then they go to the doctor and you have your ultrasound. Oh, there are fibroids here. And they have an event-free pregnancy. And then conversely, you have those who may have challenges conceiving, or they may have a difficult pregnancy because of the presence of fibroids. So it's really an individual thing. So I'll stop there for now.
And thank you for actually taking us through it like that, because, and you mentioned UE days, and the way that you would have laid it out already starts to answer the question that I want to ask in terms of how can this impact on quality of life? Because I tell people, and I think it was less than a month ago, I was explaining to somebody that I learned the call and response for Congo Belly from you, and this level of activity. And yes, if you're walking around with quote unquote chenets, it might be very different to if you're walking around with a growth the size of a watermelon. And
yes,
not there may be individuals who think that they have one thing when it may be fibroids instead, because I don't think two things are exactly similar, but some of the things you started talking about in terms of the period and period flow being affected, it made me think of polycystic ovaries for a second as well.
That's right.
Are they ever grouped or mistaken before that ultrasound diagnosis?
So traditionally with fibroid, well, let me not say traditionally, but the research, having been in the vineyard for some time, which is also interesting. We'll probably get to that as we talk about the foundation. But very often women take a while to get diagnosed, right? Fear, just misinformation in the space, but quality of life, as you've asked, fibroids can be very debilitating. They can be extremely debilitating. So I touched on some of the coping things we start to do, and it becomes normal, right? But the cost, period poverty, the cost of feminine products, and going through a lot of feminine products when your monthlies are there because you have this condition. As we get into quality of life, and you also touched on the fact that you thought of another issue, there are many issues of the uterus that have similar symptoms, right? So we have polycystic ovarian syndrome, we have endometriosis, we have adenomyosis, just a number of issues that can affect the uterus. And sometimes you can have one, sometimes you can have multiple at the same time, right? And quality of life can truly be affected by fibroids, the presence of fibroids or any other issue of the uterus. Extremely painful periods, women missing work, the fear of, just messing up, the shame, the taboo associated with periods and, having mishaps, whether it's in the workplace, church, wherever. I remember post the surgery that I had, because I had a myomectomy to treat with the fibroids that I had. Even cycles after that, mentally, I was so conscious of not wanting to have a mess up or a mishap that I remember I was walking in a space and a co-worker said to me, there's something on the back of your dress. And I began to panic. That time was like a little hole, But, just being in that mental space. And let's push even further. Heavy cycles becoming...
And before you push any further, let's take a short break, because as it stands right now, we're going to have a big half and a small half. So before we carry it even further, we take a short break. We're speaking with founder of Fibroid Awareness Trinidad and Tobago, Clarice Archer Kwasi Nancis. And hey, that is a mouthful, I ain't playing with you. We return after this. Stay with us. Welcome back. We are having a conversation about fibroids and awareness with the founder of Fibroid Awareness Trinidad and Tobago, Clarice Archer Kwasi Nancis. And even looking at that level, I've heard of occasions where, and it may not be fibroids in this instance, but because the flow of a woman on her cycle has been affected, they didn't even necessarily want to go to the hospital, because the experience that they would have had is that someone was telling them they were sure that they had tried to have an abortion, which is why the flow was like this. And even these are some of the things that may hold somebody back from seeking diagnosis.
Yeah, intervention and diagnosis. Yeah, again, shame, stigma, taboo. I'm just surrounding menstruation generally because, culturally, like there's a shame, this very normal process that happens every month that is critical to the life cycle of the human race. There is just this taboo and stigma attached to it, right? And you've talked about hearing, these instances, but you have an issue of the uterus, and then we're gonna get a little graphic here now. You are passing heavy clots. Right? The menstrual cycle is literally the shedding of the lining of the uterus, right? But if you have issues, you have growths, you have a challenge that affects your uterus, then the body responds in a certain way. And I know from my own experience, instances where it got so graphic, if you had walked in when there was a gush or a surge, you would have felt as if you walked into a crime scene, right? And as women, we can identify, but we don't generally have these conversations so openly, which is what Fibroid Awareness TT is about. But I really wanted to just kind of zone in on wrapping up the quality of life conversation, right? So we've spoken about, just mental discomfort, living almost in a hypersensitive state because you don't want to mess up. You have to choose clothing properly, all of those things. And then let's talk about quality of life if you become anemic, exhaustion, palpitation of the heart, I actually ended up with an enlarged heart because of symptomatic anemia over an extended period of time that resulted in, of course, the heart now having to work overtime to push less blood around the body, right? And let's talk about the fact that symptomatic anemia, you need blood to survive. And symptomatic anemia can have ripple effects that affect your quality of life, mental fatigue, brain fog, exhaustion, the pain associated with the cycle. It's just happening every month for some women. And, you know, we talk about medicine. In the US, you would hear about the Black maternal health crisis, where sometimes Black women's pain is minimized. But I dare say, generally, sometimes women's pain may be minimized, but it really can affect your quality of life. And so it's important for the information to be out there so that girls and women, men as well, because we coexist in a beautiful space, and there should be that level of understanding. We have the information, and that is what, you know, Fibroid Awareness Trinidad and Tobago is about, and that's why we are excited about Fibroid Awareness Month 2025.
Speaking about that information, we have about 3.5 minutes. So however you decide to divvy it up for the foundation and the work over the month, please and thanks.
All right. So Fibroid Awareness Trinidad and Tobago is a journey that actually started in Jamaica. When I was diagnosed, of course, I was in a new space, looking for information, couldn't find central information. And so Fibroid Awareness Campaign Tobago was born as my CAP project to complete my first degree. We fast forward to 2014, major surgery. I actually did it in Jamaica, and on my hospital bed, I say divine instruction. This is work that has to be done. And so we started online, and then eventually I was accepted as an international fellow with the US State Department, and Fibroid TT was born out of that work. So we launched officially in 2018, and since then, we have been doing online support as well as community outreach, championing education and awareness for women, girls, and the wider community. And Fibroid Awareness Month is July, started by a group called the White Dress Project in the US. They are advocates just like us. And so this month we are having a host of activities online and in person. We start today, which is July 9th at 5 p.m. virtually, featuring one of our doctors, Dr. Marielle Armstrong, Tobago born but UK based. She'll be sharing on fibroids and pregnancy. On the 14th, we'll be talking about fibroids and nutrition because a lifestyle change is very, very critical to navigating this journey. And then on the 22nd of July, we have a full interactive session face-to-face at the Scarborough Library from 5:30 p.m. talking about fibroids, just fibroids in general. And then on August 3rd, as we wrap up the month, we have a free clinic where women can come and get free ultrasounds, free consultations. It's always been a dream of ours, and we are excited. So all of this is happening in Tobago. Yes, it's Fibroid Awareness Trinidad and Tobago. We will be journeying to Trinidad to take our outreach as well later down in the year, so persons can look out for that. You can find us online, www.ttconfidenceproject.org. And we are on all social media platforms, but not all. We're not on TikTok. But we are on Facebook, Instagram, X, and LinkedIn, Fibroid Awareness Trinidad and Tobago, or the @ Fibroid TT.
And with that, we want to thank you so much, Corey Archer, Quashing Answers. And some people say that the trial comes before the testimony, but definitely looking and taking what you have been tasked with and moving forward. And so on behalf of the entire crew, this has been In Depth with me, Dike Rostant. Thank you so much. We've been speaking about fibroid awareness with the founder of Fibroid Awareness Trinidad and Tobago, Corey Archer Quashing Answers. And thank you so much for joining us. Have a good one.